Hi everyone, this presentation goes over Chapter 21 on questionnaire development in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that a questionnaire is a tool for systematically gathering data from study participants. Here is an outline of the chapter. Section 21.1 covers questionnaire design. Section 21.2 goes over the questionnaire content. Section 21.3 covers types of questions. Section 21.4 goes over types of responses. Section 21.5 goes over anonymity, and Section 21.6 goes over wording of questions. Section 21.7 covers the order of questions. Section 21.8 goes over layout and formatting. Section 21.9 goes over reliability and validity. Section 21.10 covers commercial research tools. Section 21.11 goes over translation, and Section 21.12 goes over pilot testing. Section 21.1, Questionnaire Design Overview. So a questionnaire, or typically called a survey instrument, is a series of questions used as a tool for systematically gathering data from study participants. So this is any type of survey that you fill out or you have your participants fill out to give you any type of information about them. This could be demographic information about, say, their age, their sex, their gender. It could also be more specific information like about their income, their education level, or health-related information. But anything where you ask people questions and ask them to fill out responses for that is considered a questionnaire or a survey or survey instrument. So figure 21.1 goes over a questionnaire design plan, and Jacobsen has a really nice layout here on how to go over developing your questionnaire. So you want to start off with identifying general question categories, so the specific groups of questions that you want to include. Then you have a select specific set of topics. So say, for example, if your categories are demographics and socioeconomics and health-related conditions, then within that you would have specific topics there. So in demographics, it may be specific to age, sex, gender or gender identity. Socioeconomic status may have multiple questions about people's employment or their income. And then health-related questions could be broken up by different topics such as chronic disease, or it could be preventive health behaviors, or even family history. Then you would come up with the specific question and answer types. So do you want to lay these out as an open-ended question? Do you want it to be where people pick a response? So it's more like a checkbox, a multiple choice categorical question. Then you want to check your wording, check the order of the questions, and you decide how you want to present them. Then you format the layout, so any type of skip pattern that you may have. So for example, if you have a question and you have multiple questions that are geared towards females, but you asked someone if they were a male or female up front, then they would skip those questions specifically for females. Then you pre-test the questionnaire. So this is where you would sort of give it to someone who isn't really that familiar with the topic and just see if they can understand it and if they have any recommendations for readability. Then you revise the questionnaire based on those recommendations, and then you use it. So section 21.2 goes over questionnaire content. So the first step, and this is sort of a repetition of what I went over in that figure, but that figure really does give you a great plan. That first step is coming up with those topics that the survey must cover. And then once you have your topics, then you have to pick out the specific questions. And so typically at the front of the questionnaire is where you would have some sort of eligibility questions there. So your first set of questions, if you're having a survey about college students, you're going to want to ask people their age and if they're a college student. then you may be able to set up your questionnaire to say thank you, but you're not eligible for anyone who does not meet the eligibility criteria. And so several questions may be required in order to accurately assign participants to key exposure and disease categories. So if you were having a topic related to mental health, for example, you're probably not going to have just one question about depression or anxiety. There are different questionnaires out there that have been validated for anxiety that have, say, 2 questions or 6 questions. The GAD is a survey, the Generalized Anxiety Disorder questionnaire that has multiple questions related to that. There's also a PHQ, a personal health questionnaire that measures depression, and you can get that questionnaire with 2 or with 9 questions. And so there may be multiple questions needed to assign people to that disease category. And theoretical frameworks can inform the diversity of questions that may be relevant to include in the survey instrument. So a good example of this is a model called the health belief model that you may have heard in your other classes. And the health belief model, it discusses how if someone does not believe that there is a certain disease as a threat to them, then they may be less likely to take preventive measures to prevent it. And so that model is used a lot in vaccination. So for example, with a flu vaccine, if someone does not see the flu as a big perceived threat to them, they do not think that they're likely to get it, and if they do get it, their severity is not that high, then they may be less likely to get the vaccine. And so that's just an example of how a theoretical model can inform the question. So if you had flu vaccine as your outcome, you would have multiple different questions to determine why someone would or would not get that vaccine. So figure 21.2 goes over question areas. And so this is just the different types of topics that are separated. So as part of figure 21.1, it says to identify general question categories. So these are some good key areas. So you always want to include some demographic information in your study. Then you will have your key exposure, your key disease or outcome, and related exposures and outcomes. So for example, if my study is looking at Alzheimer's disease and related dementia as the outcome, and if I'm looking at individuals from Middle Eastern and North African descent and comparing it to other racial and ethnic groups, that would be my exposure. Now, what I would want to also make sure is that I collect information about their age and their sex, because there are differences in Alzheimer's disease and related dementia by age. So typically people do not present with that disease under age 65, but then people at age 85 and older would have a much higher likelihood of having the disease or presenting the symptoms. And women tend to be more likely to have Alzheimer's disease than men. Then you would also want to look at related exposures and outcomes. So it could be that individuals also have other comorbidities with the disease. So hypertension, diabetes, the different diseases that come with aging could also be part of the questionnaire. And it's important to include whatever you can to have a robust set of questions in the questionnaire. So section 21.3 goes over types of questions. So your next step is decide what types of questions you want in your survey. And typically, if you have a quantitative study, you will want to include mostly closed-ended questions. And so this is a typical multiple choice question where you allow a limited number of possible responses. You can also have open-ended questions, and these are free response questions. So these can allow an unlimited number of possible responses, but also people tend to just write an answer to the response. Closed-ended questions come in a variety of formats, so it could be a date or a time. It could be a numeric question, so it could be asking just someone their age in years, or it could be related to a scale. And so categorical questions could have a ranked response. So this would be on a scale of 1 to 5, 1 being strongly agree and or actually 1 being strongly disagree is usually how I prefer to do it, but 1 being strongly disagree and 5 being strongly agree. Rate your how likely you are to tell someone to take this class, how likely you are to refer someone to do something, or how much you agree with the knowledge that you learned in a class, or how likely someone is to have a flu vaccine. Or you could have unordered categories and they don't have a set number. So something like uh, someone's race and ethnicity, you would just list them and then they would be assigned numbers, but it's not that one category is better than the other. So oftentimes the 1 is either Hispanic or it's non-Hispanic white, and then you would go through 2 non-Hispanic black, 3 non-Hispanic Asian, and include the different categories there. You can also have paired comparisons and rank ordering questions there. So figure 21.3 goes over some examples of the different types of questions. And so I went over the date, the numeric. I didn't go over yes or no questions, but these are the binary responses. And so you could ask someone during your lifetime, have you ever smoked more than 100 cigarettes, yes or no? I went over the categorical questions that are nominal, so male for or female. An example here is what is your favorite type of film? You're probably not going to ask that in a health related questionnaire, but that's what the textbook has for us. Then we have some of the rank order questions, and education is also usually a rank order question, starting with less than high school and going to college, university degree, or higher. And we have our Likert scale from strongly disagree to agree. Then here are some examples of the paired comparison. So it could be, do you prefer to drink coffee or tea? Typically, I would recommend to have that be 2 separate questions because here you're saying, I prefer coffee, I prefer tea, I like coffee and tea equally, or I do not like coffee or tea. I usually would just separate that out into a dummy variable is what they call that, where you have a separate question for each, but you could always ask both. And then rank ordering of questions where you would rank the different options from 1 to 4. Typically from a data perspective, that ends up being harder to clean and analyze. So again, I usually keep that as a separate question. And then open-ended responses. Here the example given is, what is your biggest personal health concern at present? And you could just write out what your response is. And then typically from an analytic perspective, you would, as a researcher, take that information and then you would try and group together people with similar responses. So if someone put depression, if someone put burnout, if someone put anxiety, you could group those all together into psychological health concerns as one main theme. So section 21.4 goes into more detail about these responses, which I just went over in the table. So close-ended questions, the researcher decides what type of responses options are appropriate. Numeric responses, the question should state exactly how specific the answer should be. Categorical questions, the researcher should consider all possible options before giving it. Sometimes people will put an other box at the end and let people type it in. That ends up getting very messy when you end up cleaning up your data, but it's always good to be able to capture information that you may not have thought of as a researcher up front. And then the ranked questions where the researcher chooses how many entries to include on a scale and whether there's a neutral option. So I worked with someone once who really did not like the neutral option. on the strongly agree to strongly disagree scale. So for example, I usually will start with 1, strongly disagree, 2, disagree, 3, undecided or neutral, 4, agree, and 5, strongly agree. Well, this person did not like that 3 to be an undecided or neutral, because he said you either agree or you don't. But I think that there is value sometimes in an undecided or neutral response, because sometimes people just don't really have that strong of an opinion about it, and it's okay to not have that strong of an opinion, but it just depends on the researcher there. So figure 21.4 goes over some more examples for those ranked questions. So as I mentioned, I typically do the strongly disagree to strongly agree. That's across the top row. But you could do satisfaction, you could do negative, poor, fair, good, very good, and excellent is often used when people are asked about their perceived health status. And so there's a couple different options there. If you're working on a survey for a group project, you can always come back and use these as potential options. So section 21.5 goes over anonymity. So anonymity is the inability of the participant's identity to be determined from his or her responses to a survey instrument or records in a database. There should be a rigorous and transparent plan in place for protecting the privacy of all participants and confidentiality of the information they share. So if you're doing a cross-sectional survey of students or participants at a clinic, or anyone you work with, it's really important to not collect identifiable information about them if you don't need to. If there's no need to know their specific date of birth, their name, any very specific identifiable information, social security number or medical record number, then there's no need to collect it. And you really want to make sure that their responses are anonymous. And they also may be more likely to give you truthful responses, particularly on sensitive topics, if there is a plan in place to make sure that the responses are anonymous. If you're going through a formal research process and not for a class project, you will have to go through the institutional review board process, and this is an ethics review, and they will make sure that you have that rigorous and transparent plan for protecting the privacy of all participants, because sometimes people do have to collect that information. If you're doing a pre-post test, if you're doing a randomized clinical trial and testing, say, cancer treatments, you have to be able to somehow link their information, but it has to make sure that the bias is removed from people knowing, say, that they're receiving a placebo or receiving the drug, but then also making sure that if they're in your randomized clinical trial for cancer treatment, then a lot of people may not know that they have cancer, and they might not want people to know that they have cancer. So you have to make sure that their anonymity is protected. So section 21.6 goes over the wording of questions. And so after you draft your questionnaire, check each question for clarity and confirm the responses are also carefully worded. So one way to prevent this, to have to change the wording of questions, is to use previously published questions. So if there's a survey out there already, you can use those questions. You cite those questions. It's actually preferred that you use a validated questionnaire. So thinking of serious psychological distress. So there is a questionnaire by Kessler, and it includes 6 questions, and it asks people about feeling sad, feeling worthless, feeling hopeless. And you would want to use those questions verbatim instead of using your own. Same thing with the generalized anxiety disorder questionnaire that I mentioned, and also the PHQ-2 and the PHQ-9. If the survey is already out there, you should use the questions and then reference it because it's already been shown to be reliable in measuring what it's meant to measure. That's the internal validity of the questionnaire design. But sometimes those questionnaires don't exist. So you have to come up with your own questions. And so that's why it's also important to pilot test, which we'll cover again in a little bit. When you pilot test your survey, then people can tell you if it doesn't make sense. And so that's why it's good to pilot test questions on people, say, maybe who aren't in the public health field, maybe someone who's a business who may not be familiar with lingo. And so you can make sure that everything makes sense. So figure 21.5 goes over questionnaire problems to avoid. So the big words, the jargon, that's the word I was looking for. So something, say, have you ever had a myocardial infarction? So if you ask people that, they may not know what that means. And so you should use a less technical term like heart attack. Undefined abbreviations. So if you have a questionnaire and you put high BP in there, people not know that that means high blood pressure. Try to avoid ambiguous meanings. So an ambiguous meaning would be what kind of house you live in. Okay, well, what does that mean? Right? It could be an apartment. Is it rental or owned? Is it a duplex? Is it detached? Um, there's all sorts of problems with that. Also vagueness, do you exercise regularly? Well, what is regularly? You want to define what that regularly is. It's a certain number of minutes per week. And what type of exercise are you trying to measure? Try to avoid a double negative. So I did not find this visit with my doctor to be unpleasant. That just doesn't make sense. Faulty assumptions. So for example, do your gums bleed during regular dental cleanings? Well, how do you know that they have regular dental cleanings? A 2-in-1, so this is a double barrel question, so I always get students on this during group projects. Do you exercise at least 3 times a week and eat a healthy diet? It's always better to have these as a separate question. Um, Things that may be impossible to recall. This really is a problem of information bias or recall bias. So how many apples did you eat in a typical week when you were a child? Well, I don't know. Unless you've eaten the exact same thing, you're probably not going to remember. Too much detail. So asking someone to put any prescriptions they've taken for 1 month or longer in the last 10 years, or sensitive questions. Have you ever hit, scratched, bruised, or otherwise physically injured an intimate partner? Those are things that you would want to avoid in, say, a survey for a class because of the legal ramifications and the need for reporting any potential abuse. Then you will also want to avoid hypothetical questions. So have you ever thought about or would like to lose 10 or more pounds? Leading questions, so trying to introduce your own biases in the questions, such as what is your impression of the work done by the dedicated public servants who serve our community every day through tireless work at the county health department? Leading answers, such as how would you rate the availability of visitor and patient parking at Center City Hospital? Answers with a poor scale. This is a very interesting scale. How many hours of TV do you watch every week? 0, 1 to 3, 4 to 7, 8 or more. Well, what if it's half an hour? Um, Lack of specificity. What is your income? What is that trying to measure? Is that per week, per month, per year? Is that net income? So after tax or gross before tax? You want to also avoid any missing answer options. So what color are your eyes, brown or blue? There are many other potential colors such as green. And overlapping answers. This one's hard to avoid sometimes. I see this a lot. In a typical week, how many days do you eat fish? 0, 1 to 3, 3 to 5, or 5 to 7. Well, if you have 3, then do you pick 1 to 3 or 3 to 5? Same with 5. Do you pick 3 to 5 or 5 to 7? So those are all some questionnaire problems to avoid. This is really good to reference when you're making your questionnaires for any group projects. So section 21.7 goes over the order of questions. So there's different ways to put different questions. It depends on your study, the goal of the study, um, and really sometimes researchers have different preferences for this. So one way of doing it is to start off with the easy or least general questions before moving to more difficult and sensitive questions. You will always want to group similar questions with similar response types together so they can be asked consecutively. Some people like to mix up the questions to prevent habituation, but some of the problems that can happen with that is if you say, so if you have 5 questions that say on a scale from 1 to 5, rate your knowledge of different public health topics. So people might go through and just click agree on all of them. Now, if you switch the scale within those questions, some people do that on purpose because they want people to actually read the question, but they don't end up actually reading the question, and so they end up giving you a wrong response. So, it really just kind of depends. I know people who don't want to put demographics up front because they want to have the exposure question first and then the outcome question second. But then that may also be kind of alarming to people if you all of a sudden ask them about their health and then later on ask them easy questions like what's their age, what's their sex. Um, a lot of people like to avoid adding income up front because people don't tend to answer that question. And if they do, they tend to answer it incorrectly. And so there's all sorts of different ways to do that there. I typically try to make sure that I put some of the demographic information up front and then make sure that the exposure and the outcome is very prevalent and present up front. But then I also make sure that within my description of the study that I include the purpose so it's not alarming why I'm asking them those questions. So section 21.8 goes over layout and formatting. So both paper-based and electronic data forms require careful attention to layout and spacing. So most surveys now are done electronically. However, sometimes people do a paper-based survey. If you are at a conference, if you're at a lecture, and people want that data right away, they may put it on a QR code so people can just scan it and fill it out on their phone. But then others may think that it's better to just give people a half sheet of paper, let them fill it out, and turn it into a box. I think the electronic surveys are faster and easier to use because you don't have to enter the data. But the paper survey can still be done. And so it's important that on both formats that you check for grammatical errors, misspellings, missing questions, gaps in the logic, unclear instructions, formatting, and any other issues. So you always want to make sure also the typeface and the format is readable and sufficiently large, and then it's the same. It's very distracting when people put multiple different fonts on a same survey or multiple different sizes on the same survey, or they have a question where you're supposed to check one box, but then people end up seeing it as if they could check multiple boxes. So it's all part of the layout there. Computer-based data entry programs allow the researcher to force participants to provide an answer, so you can set it up to where people can't go on to the next page of the survey unless they answer that question. And required fields may force them who don't want to provide the answer to quit the survey and leave the subsequent items unanswered. So there's good and bad about forcing the response. And then you can also do the skip logic codes so that people's irrelevant questions are not there. So if you ask someone if they had breast cancer and they said no, then they move on to another section about, say, diabetes, where if someone had breast cancer and said yes, you could ask them questions about the different treatment type or the stage of the disease. So figure 21.6 goes over an example of a self-response questionnaire. And so here it just has a couple different questions, such as the date of birth, sex, and health history. So ever been diagnosed with breast cancer? And then here you can see this skip pattern. So if no, skip to question 8. But if you had yes, then you would answer the questions about, say, have you had a mastectomy? Here it's asking specifically date of birth. What I would say is if you don't need to know someone's specific date of birth, I would just ask them their age. So figure 21.7 goes over an example of a telephone interview script. So typically when you have your survey, if you're doing it self-administered, you would just have a little blurb up front. And you could have that online as well. But if you're calling somebody, it's good to have a script to state how you're going to ask your question. So at the beginning, you would say, thank you for agreeing to participate in this health study. I'm going to start by asking you some basic questions, whereas that information wouldn't be included if you were doing it and having them self-administer it. And then it's important also to make sure if you are doing an interview as a script and you're asking people questions and you as the researcher are writing down the answers, that you don't ask them the questions that you're not supposed to ask them. So if you ask them whether they were diagnosed with breast cancer and then you ask them about a mastectomy, they may not give you an accurate response. So section 21.9 goes over reliability and validity. So a reliable and valid questionnaire measures what it's intended to measure in the population being assessed. And so this is the internal validity. And so reliability is precision. So this is when consistent answers are given to similar questions. So if you ask people 5 questions about their communication with their healthcare provider, you want to have it be consistent. If you're trying to measure the same thing, then you want it to have a very similar response to all the questions. And if you were to ask some of those questions multiple times, they should have the same outcome. Validity is the accuracy, and so this is established when responses or measurements are shown to be correct. And so this is a good figure of a dartboard that shows reliability and validity. In the past, I've actually brought a dartboard to class sometimes, which has been kind of fun to see how different the responses are. So a valid response, the accurate response is the bullseye here. And so if everything is neither reliable nor valid, they'd be all over the place. Now, if something is reliable and precise but not accurate, then they're going to the same place each time, but they're not going where they're supposed to go and not measuring what's supposed to be measured. If something's both reliable and valid, then it's in the center of the dartboard at each time. So internal consistency is present when the items in a survey instrument measure various aspects of the same concept. So internal consistency can be measured using a Cronbach's alpha or a KR21. So a Cronbach's alpha is typically what I use when I'm trying to determine whether the questions are related. It's used with the variables that have ordered responses, and so I'll say a Likert scale, and then the KR21 is used with binary variables. You can also test the retest. You can also run a test-retest reliability statistic, and so this is demonstrated when people who take the baseline assessment and then retake the test later have about the same scores. Then you can also test the inter-observer agreement or the inter-rater agreement. And this is the degree of concordance when you have independent reviewers assessing the same study participants. And so if you're having people observe different interactions between, say, providers and patients, you should have the same results when you have two different people rating it. A kappa statistic is also used pretty often. I've used this several times, and this is when two different assessors um, who are assessing the study agree more often than is expected by chance. And so you just want to have a higher level than would be expected by chance. And so figure 21.9 goes over the calculations for that. You can do that on your own time, and there's an example in the book for it there. But you want to make sure that the observer 1 and observer 2 agreements are in a 2 by 2 table here, and then you can calculate the kappa coefficient. You can also have it calculated for you in programs like Stata, SPSS, and SAS. Then some other questionnaire statistics that can be run would be the content validity or the logical validity. So this is when subject matter experts agree that a set of survey items capture the most relevant information about the study domain. Then there's also face validity, and this is when content experts and users agree that a survey instrument will be easy for study participants to understand and correctly complete. Then you also have some other statistical components. You have the principal component analysis, which creates one or more index variables, and these are called components from a larger set of measured variables. Then we have construct validity and factor analyses, and these are all different terms related to questionnaire development, reliability, and accuracy of questionnaires. And so these are all things that you'll probably want to look back to on the future, not necessarily something that you would need to do in an undergraduate research methods course. But construct validity is a set of questions in a survey instrument is supposed to measure the same thing. And so this is where it measures that theoretical construct it's intended to assess. And so if you had perceived susceptibility to a disease, if you have multiple different questions related to that, you want them all to make sure that they're related to that theoretical construct of perceived susceptibility. Then there's factor analysis, and this uses variables to model a latent variable, and this represents a construct that cannot be measured directly with one question, but may have a causal relationship with a set of measured variables. And so there's different types of analyses like structural equation modeling that are beyond the scope of this course that can be used with that. Then we have several different types of validity here. Convergent validity is when two items that have an underlying theory which says they should be related are shown to actually be correlated. And discriminant validity occurs when two items that a construct says should not be related are shown not to be related. Then finally, we have criterion validity or concrete validity, and this uses an established test as a standard for confirming the utility of a new test when it examines a similar theoretical construct. And so if you're comparing and trying to validate a new survey item to a previous one. Concurrent validity is evaluated when participants in a pilot study complete both the existing and new tests, and the correlation between the test results are calculated. And then predictive validity occurs when a new test is correlated with subsequent measures of performance and related domains. And so these are all different types of validity for questionnaires. Again, you're probably not going to be calculating this or discussing this in an undergraduate research methods course for a project, but they're just good to be aware of, and you can always come back and look at them in the future if you go into a public health research position. So section 21.10 goes over commercial research tools. And so there are many different surveys that are widely used and have been validated that are available to researchers. Some of them you have to pay for, some of them require a fee. So the first one that comes to mind to me is the newest vital sign, and the newest vital sign is a measurement of health literacy, and this is available through Pfizer. It is actually free to use through a previous grant that they received in order to create it, but you can just go online and download it, and you don't have to get their permission to use it in a study. It has an ice cream label, and it has people um, ask questions about the fats, the calories, and so it tests numeracy as well as literacy. Another one that I've had students use before prior to working at UTA was called the EQ5D, and this is a quality of life measurement. This was actually very expensive, and you had to pay to use it. And so typically it's not going to be used unless you have grant funds to be able to use it. So section 21.11 goes over translation. So depending on the population that you're working with, you're probably going to need a second language in your survey, whether it's Spanish, whether it's Arabic, whether it is another language. And so when you have to translate a survey, it's important to also have a back translation or a double translation done. And so one person translates the questionnaire from the original language to a new language, and then you have someone else translate it back. A comparison of the original version of the survey with the back translation version should show any potential issues that may have occurred with the translation. And so it could also be, say, the dialect for the population that you're using. You want to make sure you have someone that speaks that same dialect. So for example, if someone is translating it into Spanish and they're from Spain, it may be different than if someone is from Mexico. And finally, section 2112 goes over pilot testing. And so this is the final step before revising and then fully using your survey. But this is where I mentioned before that you really want to test your survey on a few different people before fully implementing it to make sure that all of the questionnaires make sense and that the wording is appropriate. So that is it on chapter 21 on questionnaire development. Thank you for listening.